I'm a senior registered nurse in Singapore with more than 35 years of nursing experience. I worked in several places, but my interest mainly includes community care and geriatric. Today, I will talk about my carer. I'm working in a company called Keren. We provide home care services like medical escort, where nurses will accompany elderly to the hospital for appointments. Respite care, where nurses will take care of the elderly at home, and home nursing procedures like feeding tube, change of catheter, and wound dressing. Telenursing and care plan. Telenursing is conducted by our carer, whereby the relatives of clients can give us a call and talk about their medical condition. Caregiver training. We are giving caregiver training to caregivers in Singapore, and we intend to give this training in Indonesia for nurses too. But if you have any queries, please do visit our website. Now, today the session is about what we know about COVID-19 and how to control its spread. Measures taken by Singapore community care sector, infection control, and PPE usage. What should you do when performing home care? What do we know about COVID? According to WHO, the COVID spread primarily from person to person through droplets infection. When an infected person were to come in contact with a person who's infected, this infection is spread. And if these droplets are left on objects and hard surfaces, and a person were to touch it, they will fall sick. Let's look at the symptoms. Fever, cough, sore throat, and shortness of breath. 80% experience mild symptoms, but the condition may deteriorate within 5 to 7 days. Those are higher risk are those with coexisting chronic conditions. What are the precautions to take? Wearing a mask and always remembering to wash your hands frequently. And when you cough or sneeze or you have to cover your face and protect again so that the droplets do not spread. And if you're sick, please see a doctor and stay at home. These are statistics in Singapore, and as of 31st August 2020, 34,084 cases were reported. Out of it, 21,699 were discharged. Here is a statistics in this slide. You can see a statistics of how COVID spread in Singapore. In the first phase, from January 23rd to February 23rd, all the cases were from Wuhan. Subsequently, we saw a spread in the community from February 4th. It was the start of our local transmission. Then Singaporeans were returning back from overseas also brought in the infection. This was in 10th of March. Subsequently, the spike came up among the migrant workers in the dormitory in Singapore from 1st April. How did the government prevent measures to flatten the pandemic curve? This was by actively doing screening and swab tests among those who are high at risk, like the migrant workers and the healthcare sectors and preschool workers. And also enhance environmental cleansing and more frequent cleaning of public areas. Restricting clients and staff to remain in the same area of work zone and doing social distancing. If not well, to stay at home and see a doctor. Measures taken by Singapore community care sector. So these are general guidelines of the institution. In nursing homes, clients and the elderly were taught to wash their hands frequently before and after meals as well as activity. As for the staff, they were all segregated to do split zoning and not to leave the place to other areas. As for the senior activity centers, it was closed down and they were advised to do simple exercises at home. Home care is an essential service and still continues. How do we leverage this teleconsult? Doctor consultation was done in the event that the elderly need to be seen by a doctor, where they do a teleconsult. From the teleconsult, the doctor will advise the elderly of their medical condition and treat them accordingly. But in the event where the doctor needs to go down to see the elderly, they have to do a face-to-face consultation, which is one-to-one consultation. And during this period, the doctor will take extra precautionary measures so that this will prevent from any transmission of infection. Nursing homes. There's a strict guidelines in the nursing home, whereby the staff, if they are not well, they are not supposed to report for work, but they have to see a doctor and stay at home. But also staffs are advised to maintain movement logs where their movement is actually captured, and there's no visitations in the nursing home, whereby nursing home staff will facilitate a video call, and one through to the family can communicate with their loved ones. Okay. And infection control. How do we maintain infection control? By doing segregation of zones, which is called split zoning. So they do not move from one area to another area. And also the staff as well as the elderly have to monitor their temperature twice a day. And if there are any changes in their respiratory symptoms, then get medical attention. Okay. Measures for home. Minimize home visit so that the virus do not spread to the staff or seniors. But the services that will continue is home medical, nursing, and palliative care services to continue. Infection control and appropriate PPE usage in the community care sector. Okay, so this one applies to everywhere. Okay, even in nursing home, inpatient hospice, center-based services, as well as home care and other community services. Okay, in cases where there is no indication of and it's a normal where there's no showing of any respiratory infection, a surgical mask must be worn at all time. And when the mask is soggy or soiled or wet, you have to change it because it's only singular use. So does an apron and glove will be worn if there is when you do a procedure where you will get exposed to the fluids. Recommendation for guidelines of when you do certain risk procedure, high risk procedures like suctionings, NGT suctionings, insertion, NGT insertion, that is insertion of the feeding tube or swabbing, you have to apply the N95 mask and yellow high risk gown and gloves, and even eye protection in case the secretions were to get into your eyes. And remember, they are all singular use. And in case of this client with or anyone with the acute respiratory symptoms, so we need to use the N95 mask, blue gown, apron, and to protect you from all the bodily fluids, and gloves and eye protections. Okay, what you should do when performing home care. So in carer, what we do is that prior to the visit, we make a phone call to the family members, and on the day of visit. So my carer nurses will find out to see what is the condition or the situation at home. After establishing this, we advise the family member to use face mask and maintain social distancing of 1 meter. So we will review and see if everything is fine, then we will proceed. The carer will proceed to have the home care visit, and then with this, we will actually see our patients at home. With that, if you have any questions, visit our website, and we also do free telenursings. Do WhatsApp at this number and get a certificate of attendance. Please fill in our form here. Thank you.
Mas Puri masih mute.